is the use of complementary and alternative medicine together with alternative religion more and more attractive, especially in the area of healthcare. And what can we Christians learn from this? So by complementary and alternative medicine, I mean the following. So these are modalities or techniques that are not conventional, that are not mainstream medicine. And they are emphasizing a little bit more holistic approach towards our health. So this is a kind of very general definition. In the same way, I'm providing a kind of very general definition of religion as a system which influences our action by providing possibilities for ritually maintaining contact between the everyday world and something metaphysical, like my search for meaning. This is religion. An alternative religion in this case would be whatever is not traditional, whatever is not well-established religion, a kind of conservative religion. So people who are attending alternative religions, they believe that they belong somehow to a kind of future or to a kind of growing movement that is different from materialism. Now, please, I'm very aware these definitions are descriptive, are very open, and we can easily criticize them. But let's see. So what is coming out in our time, I'm talking about modern, postmodern time, new age time, whatever we want to call it, the individual is more and more important. And the individual is a kind of guiding principle or the authority for what is good, what is right, what shall be done. My experience as such becomes crucial. And following this logic, I based very much on my true inner life. So the life as such, and consequently my decisions as such, should be based on what's going on within me, here and now. And I wish that I can transform myself into a kind of higher spiritual mental being. So I'm not so much concerned about what's going to happen in the afterlife, but I'm more concerned about this progress development now. If you wish, again, this can be applied very much to secularized societies, either here in America or in Europe. So there is a strong emphasis on emotions, on subjective experience, combined with individualism, my choices on one side, and on the other side, this weak tendency or belonging to organization, especially traditional religions. How come that something like this happened? Let me provide you a short historical overview, and even here I'm aware it's one-sided. So first of all, there are 3 steps. The first step is provided by Michel Foucault, who approximately 50 years ago wrote in his book, The Birth of the Clinic, something like this. He says, we introduce this social differentiation between physician and patient. So before, the physician, the doctor, visited me at home. So we can call this bed medicine. And when the doctor was at home, he was treating not only the patient, but the whole family. Now, at a certain point, the patient is moved to the hospital. Once in the hospital, patient becomes an object, somebody with a disease. At the same time, we lost all contacts with his family, because when the patient is in the hospital, the family stays home. So we are moving from a person-oriented cosmology towards an object-oriented cosmology. In addition to this, the physician as such, which was before understood as a kind of healer, whose duty was to preserve the patient as God's creature in a more or less artistic way, now he or she became a scientist, whose duty is to understand illness in a kind of rational way. And patient becomes a body, since as a matter. to which we will apply scientific methods, identify symptoms, illnesses, causes, and so on. So if this is the first step, let's move to the second step. Now, the medicine has been developing profoundly fast. Thanks God we have it. And it became a kind of strong science. In this science, we follow strict, rigid rules where there is no space for religion. So whatever becomes metaphysical is considered to be non-empirical because we cannot measure, and as such should be, if not excluded, at least we don't pay attention, yeah, because it's not scientific. So there are a kind of two consequences of this way of thinking is the medicine, yeah. We are treating the patient with medicine, hoping that this pill will heal this disease, that pill, that disease, at the end, everything will be fine thanks to medicine. So it's a kind of rational approach, which is somehow imbued with secularism in a certain way. And even more, what was once considered to be sin now becomes either a crime or sickness. I mean, as we know from history, epileptic seizures, many times people thought, well, the person is possessed by bad spirits. Now we know it is a disease. So this is just one small example to show the shift which we are facing. If this is the second step, let's move to the third step. Now, medicine became a distinct social and academic system, very well established, which takes the power, or like almost is willing to subordinate and exclude whoever, whatever does not belong to this system, especially when we talk about academia, yeah? Whoever is not sharing our approach somehow should not find any place with us. So we talk about this differentiation. And our society is very good in this. We have different systems. Medicine is one of them. We can talk about art. We can talk about other areas. Each system has a code. As long as you follow that code, you're welcome. If you don't follow that code, there should be no place for any alternative. Since medicine talks about with what is sane or insane, yeah, religion talks about transcendent, immanent, so we have two different codes, and there should be no dialogue, collaboration, at least it seems so. This goes so far that even the World Health Organization, yeah, made a kind of statement here. There should be separation. Okay, but now still we need somewhere somehow include spirituality, not religion, especially when we talk about the last days of our life. I mean, what I'm trying to show, as much as we are trying to separate these two areas, yeah, on the other side, we struggle so much to do so. Since we don't want to include religion, then at least let us live in spirituality. Once everything is over, once the medicine cannot help anymore, then maybe spirituality can do a kind of miracle. So now the question is, why is alternative medicine and alternative religions, why are they so attractive? I'm referring to an experiment which was made in Switzerland. Switzerland seems to be very avant-garde in this area, including both alternative medicine and religions into the healthcare system. And somehow what came out is something like this. So alternative medicine is very like appealing because it is not determined. It's somehow very flexible. It's boundless. And because of this, it seems to be that the doors are open now, not only for what is sane, insane, but as well to what is transcendent and immanent. I mean, once we lose the structure, a kind of rigid way of thinking, it looks like there is a new opportunity for dialogue. Since there is no system, there is no organization, orthodoxifications, I mean, right way of doing what established religions are suggesting, we start thinking in a kind of different way. So non-systemic forums like alternative medicine, alternative religions are able to combine religion, medicine, and therapy somehow together. And then the common denominator in this case is the energy, which somehow helps me to move from one level to another level. So they go hand in hand, alternative religion, alternative medicine. Just let me give you one example, aromatherapy, yeah? If aromatherapy can heal my body, then eventually it can heal my spirit as well, because I will become relaxed, calm. Eventually it will help me to leave my spirit to go to a different level. Alternative medicine as well as religions are placing the patient in a much broader context. And that new context seems to be a new opportunity for the patient to learn something new. So there is a kind of desire to learn something, and the new context allows me to do that. If I'm able to learn something new, that means we are talking about a personal development. So suddenly my autonomy is regained. My feeling of responsibility became much stronger. So I, as a patient, I'm actively involved in the process of healing, of controlling my own health. And the alternative medicine and religion becomes a resource for self-empowerment. And then we can say that we talk about spiritual development here, yeah? And since there is no strong approach, do this, do that, the agent feels much more flexible and much more creative and willing to be engaged in this process of new self-perception, of new world. And since there is no authority, there is no strong practice, the patient as such, I mean, the agent as such, becomes authority in his way of acting. So what we have here, very important, is a kind of self-empowerment, higher self-esteem, as well as the prestige. I mean, physicians who are dealing with alternative medicine or alternative religion as well become much more respected because they seem to have an additional power which goes beyond conventional medicine. So what's the point? That we mentioned this today already so many times. We need to take care of human on different levels, on this emotional, metaphysical, transcendental, spiritual level. There are different needs which are calling for our attention, and consequently we should integrate them. So what is new now here is this self-empowerment. It is not, of course, the doctor will help me to heal, but I, as a patient, I need to collaborate here. So let's talk about self-empowerment, which will somehow bring me to a different, higher level. And this self-empowerment somehow includes not only me as patient, but my family, my relatives, like extended family, which should support me, help me in this personal growth and development. So what can we as Christians learn from this? First of all, there is no lack of spirituality in our time. Even more, you mentioned this already many times, yeah? People are looking for something spiritual. People are trying to be religious. Then the second point is, which I'm somehow taking from the Bible. Jesus is asking before he makes miracles, what do you want me to do for you? I mean, we can take this as a self-empowerment. Faith growth or personal growth is always based on, am I willing to continue to do something, to move? So deep down, it is up to me. And sickness as such illness as such is an opportunity. So what will I do with it? If this is not the end of the world, let's take it as an opportunity for my growth. So alternative medicine, alternative religions are much less concerned with forms and rules. If this is the case, yeah, it might be that this is for Christians, I mean, a kind of opportunity to reestablish a much more personal connection with Jesus, who was, in a similar way, less concerned with forms and rules. So maybe it's, for theologians especially, time to a challenge, how to rediscover a new language, which will help us to understand holistic approach from the Christian point of view. And as a special point here is the matter of confession. Confession, such a beautiful practice, such a beautiful tool, where literally I'm taking care of my body on different levels, especially on the emotional and spiritual level. Somehow we lost it or we are losing it, while the holistic approach is literally trying to reintroduce it in a slightly different way. Thank you so much.